Always happy to have Jamie Swift with us on Monday. She's the Chief Infection Prevention Officer for Ballad Health. Jamie, thank you so much for being here. I know you love seeing those dropping hospitalization numbers as much as anybody. What's going on? What do you think's leading this?
Yeah, so, obviously we're excited to see those numbers going down. There's a couple of things. So we really do feel like we've hit that peak from our holiday surge. And so I think that's the majority of what you're seeing is, I think Thanksgiving, the peak was really rough. And I think a lot of people saw that after Thanksgiving. I really feel like there was a little bit more adherence around Christmas, less gatherings. The snow may have helped keep people at home. So I think we just had less of that risk around Christmas. And so I really think we've reached that post-holiday peak. We're starting to see that come down a little bit now.
We're also seeing a drop in positivity rate, and that's confusing for me, and I think for a lot of folks. Positivity rate meaning the rate of tests coming back positive, and so now we're down at below 20%. You were at like 35 at one point. You want to get to 5, so we're certainly not where you want to be. To what extent do you think we could be seeing either the beginning of some effectiveness from the vaccination program, which is now affecting thousands in our area, or herd immunity, where just so many people have had it that there's an immunity to it?
Yeah, we're not to herd immunity. We're a long way away from that. That would take many years to get there without vaccine. So, I think you have obviously some natural immunity where you've had cases in the region. You are starting to see a little bit of protection. I mean, it's very early to see that protection from the vaccine, but we know it's there. We've seen that. We know that there's some protection after that first dose. We now have people in the region who are fully immunized. Some of our healthcare workers have had that second dose. They're 7 days past, and at this point, they're fully immunized. So that every individual person who has immunity helps break that chain of infection. The positivity rate going down really does tell us that the burden of infections coming down. Like you said, we're still much higher than we need to be, but it's coming in the right direction right now.
And I know you're working with all your community partners, including schools, and I know for many families, the schools is where their attendance is being driven directly by those positivity rate numbers, the COVID transmission rate numbers, and hospitalizations. What's your message to schools tonight? I know you're not setting policies, but if you could talk to those people who are making those choices about whether to let kids go back to classrooms, what would you say to them based on these numbers?
Yeah, we really in Tennessee, our health department partners are on the phone once a week. Either myself or somebody from my team's also on that call typically when we can be. So we're having those conversations. The health department's having those conversations, kind of helping the schools make those decisions. Obviously, when we go back, we just want to make sure that we're doing it safely with masks, with social distancing, and all of those things that we need to do to keep schools in session.
The critical issue right now, it appears it to be, is the supply of vaccine. If you could wave the magic wand right now, I know it'd just be that we could get more of it readily available. Are you seeing any indication? Just today, President Biden said he wants to do a 1.5 million vaccinations a day. That's the goal. Are you seeing any indication that we're going to see an improvement in supply in the near future?
Unfortunately, right now, no. Everything that we're seeing is that the demand across the nation, in the states, and right here in our region far outweighs the actual supply that we have. We've worked with our health department partners. As a region, we've proven between health departments and our sites, we can get vaccine in arms. We can do it very efficiently and effectively. It's why currently, our region leads the way in both states for those percentage of people vaccinated. The problem is we just don't have the vaccine to give right now. What we have is gone very quickly, and so it keeps us up at night. I want to get that vaccine in arms as much as anybody. We really just need to get the vaccine into Tennessee and into Virginia so we can give it.
Many people continue to have concerns about the long-term impact of the vaccine. And I've seen recently that as many as 40% of Ballad staff hasn't gotten a vaccine. And I know you wish everybody would get it, but are you seeing anything now, weeks into the process, that would lead you to believe that there could be something of concern about the vaccine in terms of long-term health risk? Or are you green lighting this thing still at this point?
Everything we see from the research is, this is a safe and effective vaccine. Certainly, you're going to have those very rare side effects that happens with any vaccine, and I think sometimes those get a lot of attention, and that can happen with any medication, vaccine, but you've got to remember the overwhelming majority of people who've received this vaccine have done extremely well. On the flip side, for every person that we talk about that has a rare reaction to the vaccine, we're losing thousands of people every day to actual COVID. And so, we really just want people, if there's any sort of allergic reaction in their past to IV meds, we want them to talk to their doctor, make sure they're a candidate for this vaccine. But once you're cleared, then, so far we've given this vaccine with great results.
You've had COVID. What do you say to others? If you have had COVID in the past, are you recommending they get a vaccine?
So basically, the CDC answer is yes. No one should, not get a vaccine at this point unless there's a medical reason. So there's a couple of things. We know that you're going to have natural immunity for about 90 days, probably longer, but currently the CDC literature still says 90 days. Some physicians are telling their patients to wait that 90 days just to kind of, free up vaccine for someone who doesn't have that natural immunity. If you received monoclonal antibodies or convalescent plasma as a treatment in the hospital, you do have to wait 90 days from the day of that treatment before you can get your vaccine.
Some great advice, as always. Jamie Swift, we appreciate your time and efforts. Thanks so much, and thanks to everybody at Ballad Health taking care of everybody tonight.
Thank you.
All right, Sarah?